All right, welcome back to the show, everybody. On today's episode, we have a very, very special guest, Dr. Reena Becerra. Dr. B, how
Hello.
you doing, ma'am?
Hi. Nice to see you. Thanks for having me.
Absolutely. Thank you for being a part of the show today. For those of us that don't know anything about you, can you tell us a little bit about yourself and what you do?
Sure. My name is Dr. Becerra. I run and operate Be Well Psychological Services. I provide virtual psychological services, therapy, support for those who need therapy and services in today's world. It's tough and people need support and help. And so I've been doing this work for a really long time. I have a PhD in clinical psychology. And so my passion is helping people. I help people from younger kiddos to adolescents to adults, couples, families, you name it.
That's awesome, Dr. B. And of the populations that you work with, what are some of the presenting concerns that they come to your practice with?
I treat anxiety and depression. I treat neurodivergence, ADHD issues, all sorts of things. I was trained in the beginning, my practicum from autism spectrum disorder. But my specialty and what I've worked with for a really long time is uh, issues centering around domestic violence or abuse. So first I worked in San Diego is where I got my start and worked for a long, long time there working with children affected by domestic violence and trauma. So, father is away incarcerated or out of the picture, and children really trying to make sense. And those are children of all ages. Since then, I've been working in private practice. 1 out of 3 women or families are affected by domestic violence and trauma. So, it's a big issue, and it's still a very big population that needs to be treated. It's hard for a lot of clinicians to work with, but it is my specialty and my passion. So, people affected by violence or by trauma or by a toxic relationship, it doesn't have to be a physical relationship. It could be emotional abuse, financial abuse. There's a lot going on in the world today, and so that is my specialty and my passion. It used to be that I'd have like a full caseload of women, and now it's really turning into more a mixed, a lot of men in toxic relationships. So I'm excited to empower men just as much as I empower women.
Wow, so many threads to pull on, Dr. B. And let me take a second to think about where I want to start. Okay, I got one. There's a lot of specialties out there. We got EMDR, Gottman, narrative, all
Yeah.
the great focuses out there that are in demand. For those viewers that maybe don't know anything about the therapy field, what focus do you use? And if you can explain that in maybe like simple terms that we can understand.
Yeah, I use a lot of different modalities. There's a lot of clinical terms to what I do, but I kind of blend them all together. So um, it's more about, for me, connection. I'm not trained in EMDR, anything like that, but I use a lot of different components. I use components like ACT therapy. I use the type of therapy that is more narrative that clients connect. The basic thing that I want to provide for my clients is protection, safety, a really safe place for them to open up and be vulnerable, whether that be trauma or I'm just, anxious about the world today and or work or I had a car accident, whatever it may be. But it's more for me about connection. I have a really high retention rate. So I see clients for years and years. Sometimes little ones that end up being teenagers and doing all kinds of stuff in the world. But I see people for a really long time. And one of the things that they tell me is that I have, ability to remember the details, to connect with them and to provide space for them that, they really need, they value, and they feel accepted and, that sort of thing. So, yeah.
Yeah, that's incredible. Dr. B, how do you ensure that the client is a good fit for you and that you are a good fit for the client?
I definitely do a consultation. I have free consultation, 20 minutes. Anyone can call me. Sometimes it goes a little longer if we're chatty, and that's fine. I'm open to it all. But really, I'm looking for someone. So someone who's not a good fit for me is someone who might be in active addiction or really needs something more like rehabilitation, like a facility, like an inpatient situation, or someone with more severe psychopathology. So, someone who might have audio or visual hallucinations, someone who might be actively suicidal, um, a place where it wouldn't be ethical or safe to provide telehealth therapy because I'm fully virtual. So, I need to make sure that we're functioning on that level. So, anyone who is a good fit for me is someone who is motivated to really change their life, who, it's okay if we're a little scared. It's okay if we're a little bit nervous for therapy or you don't know what to expect. I'm really great with and gentle and easy in taking the lead and showing you what this is all about and how it works and what a session looks like, and just somebody who's open to the process, you know.
Yeah, that's incredible. And that kind of segues perfectly into my next question, which is, some clinicians are a little bit more straightforward. They're like, hey, let's get to the solutions. I'm going to tell you, like, I'm going to be a little more directive. Others are a little more laid back. They kind of let the client lead and then they guide them. How would you describe your style?
I think I'm a mixture. I think I'm a
Mm,
blend of both. So I've had clients that are like, I want homework. Tell me what to do. Tell me, like, give me advice. Obviously, that's a misconception, is that we don't give advice. I don't have a crystal ball. I don't know if you break up with your boyfriend, what's going to happen, or if you quit your job. I can't give those sorts of, I can't do that. But I can explore what it would be like if you went for the job of your dreams, or if you didn't settle in a relationship that you, in your gut, you kind of know it's not the right one, or I don't like the way I'm being treated, or it's a one way friendship, a one way relationship, something like that. So I will help explore the factors of what it would be like, and maybe we're not there yet. Maybe we're, just we want to just take a glimpse or a snapshot of what it would be like. But it would be really amazing if in that insight my client would be able to see the life of their dreams and make, even if it's small, action steps to get there. That's what I'm about. That's what I'm hoping for my client.
ooh,
And I see
that's
it
so,
every day. I see
yeah.
it's inspiring.
Wow, that is so cool. Which actually leads me to ask this next question, Dr. B, and that is, what does progress look like for a client that partners with you?
Oh my gosh, it could be the smallest step. It's like, how do we measure it, right? So progress can look like setting a boundary. Progress can look like saying no. Maybe there's a big get together and I don't feel like going. I don't want to go because I feel uncomfortable, or I feel socially anxious, or maybe those aren't my people. And so saying no, and without apology, without oversharing or explanation. Progress can be, like I said, taking those action steps. And progress can also really be, and I really like this one, is like silence or stillness. There's a lot of us in this world that have a hard time being still, keeping our brain quiet, and the overthinking, all of that. And so to be able to have a moment of peace and stillness, that's progress too.
Yeah, that's incredible. Dr. B, often I'll have clients that are like, how long is this going to take? 8 weeks, 12 weeks? Like, I need a time frame. I got things to do, right? And as we both know, it's really hard to say, give any really good guidance on the timeline. How do you prepare clients for the inevitability that progress may be taking one step forward and then sometimes taking a couple steps back?
Yeah, it's managing our expectations. It's patience. Sometimes patience is the hardest thing, right? So slowing down. We are in a gratification society where we can chat GPT or just Google our answer, anything we need. It's at our fingertips and we get it right now. How do I do the stock market? How do I do this? It's all right there for you. How do I create a resume? Chat GPT can do that for us. Anything we need. What about if we didn't have an answer? What if it was unexpected, or, what if it's ambiguous and we don't know? How can we sit with uncertainty? And what do we do with that? What comes up for us in our body? Does my heart beat? Do I get angry? Do I get impatient? And if I do, is that a pattern that happens because whatever happens with us happens with others, right? So, if I have a client that's getting a little impatient with me, I wonder, do they get impatient with their partner? Do they get impatient with their kids when things don't happen right away? Let's go take out the trash, Johnny. Forget it. I'll do it myself, right? You didn't do it in time. Well, maybe the child needs to process as well and go, okay, hold on, let me adjust, and let me, it's this right now culture that we have. And some of these things take a lot of time, especially when we're dealing with vulnerability. In my line of work, trauma is not something that someone wants to say, hi, here's my trauma, take it out here, have it all. That's something that we chip away at. And that's something that sometimes are buried down under lots and lots of defenses that maybe someone's never ever told anyone in their life, and they're
Yeah.
telling me for the first time, and
Yeah.
that's a
Wow.
really hard thing to do.
Yeah, absolutely. And I definitely want to talk to you a little bit more here in the next few minutes about trauma and your specialty with domestic violence and stuff like that. But I like to hang out here on this client journey when they start working with you. And that is my next question is on that. How do you know when a client is probably ready to graduate, if that's an appropriate term, or kind of
Yeah,
conclude therapy?
that's a tough one, right? I have clients for years and years, right? It kind of, when the subject, when my client, and graduation is a great thing, it's an amazing thing for clients. It's a hard thing, it's a hard thing for them, and also for me. I'm a professional, but at the same time, sometimes it's like, go fly and have your life. But when they are enforcing their boundaries on their own, when they say, okay, Dr. B, I know you would have said this to me and I thought about this. You get that a lot, right? Where they, I heard your voice in my head and this is what I thought. And I navigated this situation in this way, and I'm proud of myself. And I think you're going to be proud of me. And I think, I think I did a great thing. When it's something like that, or when the content is, diminishing a little bit, when it's like, how are your symptoms? Fine. I have no symptoms. How's everything going? Great. I had a great week. No problems. It's the absence of symptoms, the absence of content. And when the client feels, and I feel clinically, that they've got it, and maybe it is that graduation isn't like, bye, see you later. Graduation is maybe we taper down to, once every 2 weeks or once a month, or a booster session every now and then. I'm here for my clients no matter what. And sometimes I have clients that come back to me after a year or after a big life event, and they know that I'm still here, and we just pick up where we left off. The coping skills, sometimes when you're out of therapy, you forget those coping skills and you're like, wait a minute, I should have enforced that boundary, or maybe I should have, spoke up for myself. But all is not lost. We can always pick up where we left off. That's the beauty of therapy.
Yeah. Oh, yeah, absolutely. And it's really awesome that you are present with your clients even after they leave. Like if they decide to partner back up with you and resume their whatever therapy that they're receiving from you, that they can do that, and that's really
Yeah.
awesome. And I think that that's a really great approach to have with your clients. Dr. B, what has been the feedback from the clients that work with you about the therapy?
I've had clients that say it's life-changing, right? I have clients short-term, I've had clients long-term, but my favorites, of course, because that's personal to me and it's my passion, is clients that navigate abusive relationships, leave toxic, abusive, even deadly relationships, and go on to become their authentic self and live their dreams. And it's really cool to hear those, they get that contact or that email of like, I'm in a healthy relationship, I found the job, I got married, or if marriage is in their plan, if not, whatever they, desire. But I'm in a great relationship. I'm in love. I had a child. I got the job of my dreams, or I'm running a company now, whatever it may be. I think, wow. And sometimes they give it all, oh, you changed my life. You changed my life. And one thing I learned a long time ago is that they changed their life. It wasn't me. I was just a part of their journey. So I give it right back to them. And I say, you did this, and you take the credit for the work that you did. You came every session. You worked hard. Every tear that you cried was healing and worth something. So it's your work. I'm just fortunate and thankful and grateful to be along for the ride.
Oh yeah, that's incredible. Dr. B, if somebody's listening to this and they're liking what they're hearing, they like your style and the way you present yourself, and they're like, I want to work with her, but they're reluctant maybe because they've never actually reached out to a therapist before, they've never done therapy. What would you want them to hear?
That there's help out there, that I am here for you, that there's no sales pitch. There's no, oh my gosh, let's book something now. This, when you're ready, is the right time, because I would prefer someone be ready. And maybe they're on the fence and they need a couple phone calls with me, or they want to watch a couple videos, or they want to see what it's like first. That's great. I can lay out the process from start to finish of what we'll do. I can't predict, progress or work, or how hard that's going to be, or how easy it's going to be, or how long it's going to be. But if you're curious, reach out, and I would love to talk with you and support you and address any concerns. Sometimes people come with a spreadsheet and they're like, okay, you need to tell me this and this and this. And then it turns out we're talking about something totally different, because that's what they really needed. And sometimes we can't see. It takes a professional, that does this all the time, to say, what if we just need some empowerment? Or what if we need to resolve the issue with your mom? Or what if we need to grieve a loss to heal, and it's something that maybe they never thought of before. So I'm here for it all, and I want to let people know it's okay, and it's okay to go slow, and we'll go at your style and at your pace. I can do it, and I'm happy to do it, and it's my passion.
Oh, I love that. That's so reassuring, and I'm a therapist like you, but if I wasn't, I would definitely partner with you. Just the way you said it and you
Oh,
expressed it, like that's incredible. Dr. B, I'd like to switch gears a little bit and talk about your work, your specialty when it comes to domestic violence, intimate partner violence. Can you tell us a little bit more about that?
yes. So like I said, I started working with the Family Justice Center. I started in San Diego, and there are lots and lots of family justice centers around the country. And so one of the things that I did when I was there was I ran groups for women who were victims of domestic violence. And victim is a strong word. Sometimes it's survivor of domestic violence, or thriver. And so whatever word works for them, however they want to identify themselves. But one of the things was I worked with little kids, and making sense. Sometimes it looked like play therapy with little kids. For women, it's much more psychoeducational, narrative trauma, like feminist therapy almost, where they're telling their story in groups. It's fascinating. I was fortunate to run some domestic violence groups, 10, 12, 15 women, all in different stages. Some of them in the shelter, coming from the shelter, some of them in San Diego. They were crossing the border to come to therapy and get the services that they need to get better for their children, for their families, all sorts of things. It was amazing. But sometimes you get someone who's living in a domestic violence, a woman's shelter, and then you get a lady who's running a business and kind of corporate, and she's kind of like, it was only, verbal abuse. Well, one of the things that was really helpful in the group situation of domestic violence therapy is that it doesn't matter if it was verbal abuse. Sometimes verbal abuse is just as bad, if not worse, than physical abuse, because in physical abuse, the scars heal, the bruises heal, the scrapes, bumps, bruises, all of those things physically heal. But what doesn't heal is you're stupid, fat, ugly, nobody would ever want you. All of those things really get inside of our core and really affect clients in a way that, hurts their self-concept. So it's important to start there. Like, where did you learn that? And many clients who have, it's statistically speaking as well, that have experienced domestic violence, it's really
Wow.
not, it's not their fault,
Mhm.
because they grew up in a home with violence, or they saw, or mom had a boyfriend that did this, or they saw it somehow, or it was in the family somehow. So they learned that this is what love is. Love is possessiveness, love is jealousy, love is hitting and violence, and they knew no better. And so part of the work is watching another client grow and going, I want what she has. Seeing, oh, love doesn't have to be, oh, I can stand up for myself. And you have a group full of women and men, supporting, and it's community, and then individually, it's learning boundaries. It's learning, what does it mean when someone calls me this name and I don't like it? And what can I do? Should I just let that one go? Or what would it be like if I said something? And what if I lose them? And then we tap into abandonment, and who abandoned you, and what happened there, and it could be your first abusive relationship, it could be your 10th, but it's all about what's inside, and what we have in our life, what we learn, from a very young age, about dynamics and about what love actually is, the definition of love.
Yeah, there's so much there to unpack, Dr. B. I wonder, what's a myth or a misunderstanding that clients who are experiencing this dynamic have to unlearn when they start their work?
Well, one of the big misconceptions, and this is even among I've seen it with colleagues, I've had consultation calls where clients say, or where clinicians say, um, I have a couple and they're going through domestic violence. Can you do couples therapy with them? And the answer is absolutely no. Um, Ethically and safety wise, it's contraindicated to have therapy, couples therapy, when there has been domestic violence. So normally what happens is you separate and each do individual therapy, and work on themselves, and then let's decide what happens with the relationship after that. If one party, say a perpetrator, really needs to get therapy or anger management or something like that, go work on that, and then we'll work on therapy over here. But the fact that we'll get through it, or and also staying together, there's a lot of stigma, there's a lot of judgment. One of the things that I say in I do public speaking for this as well, and one of the things that I say in every presentation is never, ever, 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 ever ask a survivor of violence, well, why did you stay? Why did you stay? Because there could be 15 different reasons why they stayed. And that's just re-victimizing for them to say, oh, there's something wrong with me. I didn't even do that right. I was trying to make this work and I didn't even do that right. And there's so many dynamics in domestic violence. There's cycles. I wrote a dissertation on this. It was like, there's, the power and control. There's the cycle of violence where they're just trying and trying to make it work and nothing is happening. There's power, control, narcissism. There's all these different components. It's like you can't fix it yourself. Another myth is that you can do it by yourself.
Mhm,
You need I can do it. I got it. I got it.
mhm.
People say that in therapy too, just like anxiety. I got it. But sometimes it's okay to drop that armor and to say, I need help. And I think with, professionally and personally, I think with the subject of and the demographic of, folks um, dealing with domestic violence, you need an army, and you need sometimes legal services, you need support, you need you need peers, you need community, you need professionals. And that sounds, even just listening to that right now, is like, oh my gosh, that sounds so overwhelming. but there are centers and there are free resources if you don't have the, the means that help and that encompass. There's centers that have all of this stuff, and so it's really amazing to be connected to this community and to be able to have those resources and to be able to offer referrals, or, okay, you need a good lawyer. This is what okay, you need you need a restraining order, like different things. So there's a lot of layers within this. And there's a lot of myth, a lot of stigma, a lot of shame and guilt, but it doesn't have to be that way.
Yeah, yeah, man, so many threads there, and I'm really glad that you brought up that point that there are a lot of free resources and agencies and centers that can provide help, which kind of leads me into my next question, Dr. B, and that is, if we have a young lady or even a young man maybe that is kind of, they're in a new relationship and some stuff starting to happen, and they're like, is this, like, and then they're like, nah, it's, I'm gonna, yeah, maybe it's just, I don't know. I'll keep going. You know what I mean? Like they just kind of brush through things. What are some signs that a relationship is starting to go into that kind of danger zone? Or even if it's not physical, like something that is not so overt?
Yeah. Well, what's interesting too in the, in domestic violence dynamics is it's, if you went on a first date with someone and they said, hey, you're stupid, you're fat, you're ugly, like no one's ever going to want you. None of us, any of us would say, great, sign me up. I want this relationship. Right. So these things don't happen that, like you said, that overtly, that in your face. Domestic violence is like, it's really subtle. It starts out with a slight boundary violation. It starts out with a little directive, right? I'm going to tell you a little bit. Well, I like, you like, this, well, I like it this way, and it just starts with a little bit of power, just giving your power a little bit away until you're kind of like what you're talking about, to where you're like, what's up with that? And so when that happens, it's great to go into the just a little bit of insight of what is that. I'm all for trusting your gut, but when we have, and I mean this with all the love and the respect, and some of my best friends and very personal, close people to me have bad pickers sometimes. And it's okay if we have a bad picker. And if we've had a slew of people that have disrespected us, how will we know if it's one that doesn't disrespect us that much? Right. It's not black and white, it's a spectrum. And so it's helping to see the red flags. It's helping to understand. It's helping to, if it's a name call, or it's like, okay, I've had a young person once ask me, is it okay if he calls me a bitch? And I'm like, what do you think? What do you think? Would you take that from a friend? What would you do if a friend called you that? No, nobody can call me that. Okay, but because we love someone and it's our closest person and we don't want to lose them, we're going to let that one slide, And so what is it? Where's our line? And sometimes some of us, our line is all the way over there. And sometimes it's over here too. It depends. And it's about aligning with our values. And what are our values? If we value self-respect, if we even know what that is, self-concept, what we are, and that's what it is. Sometimes victims of violence don't even know what their favorite color is, and so it's like, what's your favorite color? I love purple, royal purple, right? And so if I love purple and you're giving me blue or green, I want to know all about me, and I've got to learn all about me to know what I like, what's acceptable, and my past and my relationships and my parents and my family and who I was raised, where I was raised, what generation I was raised in, what was acceptable, all of those things, to understand why I love the way I love, or why I choose the way I love, or why I'm why I'm missing a green flag and that's boring to me, and choosing a red flag because it's exciting, or I'm just gonna like, ooh, pretty colors, right? So it's about kind of shifting that dynamic and understanding the dynamics. And I have lots of tools, like tangible tools, and I do screen share with my clients, where we do work and we're writing it down and they're journaling and they're following along. And I have lots of resources that I send home, email, all that stuff that says, you're not crazy. These are common signs that abusers use. Financial abuse, starting off very subtle, little insults, isolation, all of these different things. And you're not crazy. These are scientifically, these are methods that people use to abuse, and they're subtle.
Yeah, yeah. Wow. And it's recognizing the early signs of domestic violence. I think it's something that, like many other things, that should be taught in school, like in high school, even earlier, like we do like sex ed, kind of
Yeah.
important because we want to prevent AIDS and STDs and other things that can come from, all that. And this is probably just as important, maybe even more important than that. And why do you think we don't kind of teach more of this at a younger age?
It's a great question. And I think a big part of the answer is that this is a very uncomfortable topic. We don't want to talk about this. A lot of people don't want to talk about this. You should see when I go to a conference or I go to a networking event and I say, oh, I work in domestic violence. I work with trauma, violence, sexual assault. People go, ooh, oh, okay. Like they don't want to talk about that. Right. And why don't we want to talk about it? Because it's shameful and it has a stigma and, it's hard. And maybe me talking about maybe meeting a professional and me talking about that I work in domestic violence might trigger something in their past, right? That if it's 1 in 3 families, that means if we had one more person here, one of us would be it, right? One of us would have gone through it. And I'm betting probably all of us have had some sort of toxic relationship if we all got together, right? But it doesn't have to be stigma and shame. It could be power. You could take your power back by breaking the silence of domestic violence and talking about it. And that's what's happened. We've come a long way since 2007, 2010, when I started this, right? We've come a long way. I think in my dissertation, I wrote 1 in 4 families. Now it's 1 in 3. Economics, politics, all of these things increase hostility and views on women and oppression in women in this world. So it's I feel like it's only increasing, but that's why we have to keep talking about it and we have to keep letting people know it's okay. Look, if we see it on the news that survivors are being minimized, that we're not looking in the face of a survivor and saying, I believe you. I believe you, your voice and your experience. What are survivors thinking? Why come forward if I'm not going to be believed? Why come forward if they can get away with everything? That just shows me that I can't come forward, that nothing's going to happen.
Yeah.
So we have to do better. We have to hold people accountable. And we have to believe survivors of violence and victims of sexual assault, victims of domestic violence. We have to believe people. And we have to not shame them while we do it. We have to accept men into this community that they are also victims of domestic violence. And there's a whole nother level of shame there, right? With masculinity and saying, I was treated a certain way, right? She hit me, she slapped me. Oh, it was just, no, it wasn't. But society is not the only, it's 911 operators, dispatchers, it's police coming to your house. Hey, this is the 3rd time I've come to your house. What's going on? How does that feel being on the receiving end when you're asking for help and you're not getting help, right? I'm not out for cops. I'm not blaming police, but in every industry and organization, we can do better in accepting and believing, especially right now when there's a lot of talk about victims and little kids and things that are happening in this world. It's a tough time for victims.
Yeah. Wow. Dang, Dr. B, I think we're going to have to do a whole nother episode on what you talked about as far as the men and the toxic relationships and the shame that comes with it. Because, I had a friend who unfortunately was experiencing that, and he didn't want to get help because he said exactly what you're saying. He was like, nah, man, I'm going to be looked at as this thing, and he didn't want that label. He didn't want anybody to know that he was being kind of pushed around, slapped around. And And he just put up with it. And as much as, I'm a clinician, so I want to help, but it's unethical to help your friends. And I
Right.
was like, man, get help. I just trying to encourage him. And he never did. They ended up moving out of state, and they're still together. And hope,
Wow.
it's wild. It's wild that that is just allowed to happen. And it's really unfortunate that we're not teaching our kids like how to recognize the signs, how to bring light to this, and have open discussions, because as you're saying, that shame is such a big barrier to bringing this to light. And it's so true, right? We don't want to seem like we chose wrong. We don't want to, like, I made
Yeah.
the mistake in choosing this person. I don't want to bring it up because now they're going to look at me like, well, why did you pick him or her? And it's just like, it's such a wild topic.
And why did you stay? That stigma question. Why
Oh,
did you stay?
yeah.
Just leave. Just leave. It's
Mhm.
so easy to say from the outside
Right.
looking in, but when you're in
Yeah.
it, it's
Yeah.
not as easy. It doesn't matter. And I know, I have seen in all my work, and this is not, I'm not, clinically, but I'll do a presentation and I'll have a judge or an attorney come up to me and say, it was me too. I dealt with this as well. Like,
Mhm.
there's nobody, like, it doesn't matter your education or your intellect level. It doesn't matter where you came from. This happens to 1 in 3 people. Like, this happens to 1 in 3 families. 1 in 3 families grew up with domestic violence or some sort of unhealthy toxic relationship. And
Yeah.
so, trying to stick it out, I get it, but when you learn these things and when we can remove the stigma and shame and let people know it's okay, part of the stigma and shame is what leads to the isolation. And when
Yeah.
we're alone and when we only have our partner that's like, it's you and me against the world, baby. Well, guess what? It's like, if I don't have you, I don't have anybody else. And you're supporting me or whatever's happening in the relationship, or we live together. What am I going to do? How am I going to get out of this? I don't have money.
Mhm.
There's so many financial concerns, the kids, what's going to happen. Can I make it on my own, especially in this economy? Can I make it on my own? We have a home. What are we going to do? We have to split up assets. There's so many concerns that lead people to stay. But if you have children, staying for the children is one of the worst things that people can do, because now the children, you're modeling that this is what we accept, this is how to love, and you're continuing that generational trauma, that cycle of violence.
Oof. Dang. Yeah. So much more to unpack there, Dr. B. But I like to kind of shift gears a little bit, if that's okay with you, and I'd like to talk about you. Is that all right?
Sure.
Yeah. Awesome. So what motivated you to be a therapist in the first place?
Wow, that's a very complex question. um, I like I said back in, I don't know. I I met someone. I had my own therapist back a long time ago, and I remember asking her. Like, I was really passionate. She worked in domestic violence, and I saw the work that she was doing. Amazing woman, and I saw the work that she was doing, and I said, "Wow, I want to do what you're doing. I want to help women." And I saw women that in downtown San Diego at the Family Justice Center, there was a lot of our population did not speak English. So I saw a lot of women, being turned away by the system because they didn't speak the language, or they didn't understand, or they didn't have a suit for court. And so that agency was amazing because they provided suits. There was Dress for Success. There was all these like agencies that were incorporated. It was a one-stop shop. And in my role, I speak fluent Spanish. So, well, it was a lot better then. I don't speak it as much now, but it's like a bike, right? You got to practice, you got to use it. But I spoke Spanish really well then, and I was really passionate about helping the women and in translating and helping them, and I just would see women. It actually kind of reminded me of my grandmother, who's passed, but she had a hard time, navigating sometimes because she didn't speak fluent English. It was broken. And, I thought about helping a woman like her, and so I would see these women, and they would kind of remind me of what it would be like to help my grandma.
Oof.
And yeah, and so it was kind of an honor and a privilege for
Yeah.
me to help women and to see them get a little bit of empowerment, or to get a job, or to leave a relationship, or to develop friendships, and to have healthy friendships and or a community, and to see the spark in them is what really inspired the spark in me, and I wanted to keep going with it. And so at that time I asked, the therapist that I was seeing, like, should I go for my AA? Should I go to junior college? And she's like, go for it, do it. Yeah, she was all about it. And so then I was like, okay, well, should I get my bachelor's? Should I get my and then I applied for a master's PhD program. And I was like, oh my gosh, should I do this? And then I was like, okay, if I get in, I'm going to go for it. And I got in, and then it was all, that was it after that, so that I knew that was my passion, my purpose. There's no doubt that this is my passion and my purpose. And so that's been my service to the world, is to help empower, to help people find meaning in their life, purpose in their life. I found purpose in my life doing this work, and I love it, and I wouldn't have it any other way. And when I see someone spark up and be inspired by anything it may be that they love, or a person that they love, or a family member, a pet, a child, it just brings me so much joy to see people find their own joy. So that's kind of the short story, if that makes sense, the short story of how I became. But trauma, domestic violence, it happens to all of our families. I think we've all been affected, and it's a very important topic. And I'd be lying if saying if I wasn't, also affected. But I think that it's something that you can overcome, and there's no shame in it, and it's okay.
Yeah, that's awesome. Dr. B, what's on the horizon for you in your practice? Are you maybe rolling out an online course, maybe a virtual group? What's in the chute?
I would love to do a virtual group, especially domestic violence, something like that. I am networking a lot. I'm in Los Angeles now, but I'm virtual, so I can treat anyone in California because I'm licensed in California. But Be Well Psychological Services is my business name, and it's a take on B, because everyone calls me Dr. B, and so it's BEE, Be Well. And I think that would, partnering. I'm networking right now with other providers. I just was networking with a massage therapist on Monday, and a chiropractor, and just in the name of wellness is just connecting to other sources of wellness, health, and being well. It's growing, it's building. My ultimate goal is group practice, so hiring some clinicians that have other niches that we can just really encompass all of what being well is, and wellness. So that's my ultimate dream. But my heart is empowering, and my little niche of the world is empowering people to embrace their lives and find goodness and heal and that sort of thing. So that's just a sneak peek, but who knows where the wind blows, right?
Yeah, absolutely. Yeah, that's awesome. And if you do roll out that online group, please let us know so we can market that and push that out to as many people who would need that as possible. Dr. B, where can people connect with you?
On my website. So we're going to have my website linked, right?
Mhm.
I also have a YouTube channel. I have social media. So all of the social medias. And another thing is too, I'm going to be a little bit better about blogging and about some video stuff. I'd like to put some short, quick content about, like, you might be feeling depressed if you're, feeling these symptoms, or here's what the red flags of being in a toxic relationship are. Just some snippets for people to kind of get to know, what these things are. Just psychoeducational, really short pieces where we can just click on for 5 minutes or 3 minutes or something like that, and kind of get an idea about me and what I do and how I can help, and if it would be a good fit to see me live and doing my thing. So that's where they can connect with me. Again, I offer a free consultation, so anyone can call up and ask whatever questions that they need, and make sure that I'm a good fit.
Oh, that's awesome. Dr. B, this has been a real privilege and an honor to have you on, and just hearing and learning more about you and your practice. Maybe we could do it again in the future.
I would love that. Thank you so much for having me. It's been an honor.
Absolutely. Thanks, Dr. B. Signing out, everybody. Bye.
Thank you.